Hello to our friends in Northern Illinois, and welcome to this special virtual town hall discussion by Bickford Senior Living. My name is Melissa Smith. I will be your facilitator today for this discussion and question and answer period, because we're going to talk about all things coronavirus vaccine, okay? There's a form just below this frame that I'm in right here. There's a form right down there on this web page. At any time, if you should have a question about anything, you just put in your name, you put in that question, and then just shoot that right over to us. You have to hit the submit button, I believe it is, and have that come right to us, and we'll get your questions answered today. So here's what we plan to accomplish today, okay? We're going to answer questions you may have about the vaccine and its distribution to seniors in general and those seniors moving into Bickford Senior Living communities in your area. We are going to provide you with a timeline for vaccine distribution at all of the Bickford locations in the area. And for those of you who are hoping to make a move into Bickford in time to receive the vaccine, we will share the necessary steps to take so that that can happen to meet the vaccine deadline. And I don't know about you, but I have been super excited. I feel it's kind of a mixed emotions around this vaccine arriving, a sense of comfort, a sense of gratitude that it is finally here to help us get a grip, get a control of this virus that's obviously moving across the country. In fact, there have been more than 20 million Americans that have been infected with COVID-19 since all of this happened last year. The death statistics in seniors over 65, absolutely staggering. And this vaccine, we believe, is a real game changer. It's really going to be able to knock out COVID-19. So Bickford Senior Living did a really cool thing. They were very proactive, and they entered the federal COVID-19 vaccination program, which is why they now have access to this vaccine, okay? We have some dates in January, some in February, when the vaccine will be available to Bickford. So here is why we are sharing this information, and we feel so convicted to share this information with you, this timeline with you today. We want seniors who've thought about making a move to Bickford, have wanted to make a move, but have held back due to COVID-19. We want you to know that if you make that move before the deadline, you too will receive the vaccine early. Those over 65 who haven't moved into Bickford or another senior living community, it's going to be spring sometime before the vaccine is made available to those who are outside of senior living communities. And of course, for all the rest of us, it's going to be 2022, they believe, before everyone will be vaccinated. So Bickford has this small window to finalize the list of residents. And then once that is complete, that window is going to close. So here we're going to show you now the list of deadlines for the communities in your area. For clarity, it's really important to understand that the term deadline has more to do with a signed commitment than it really does with physically moving into the community, okay? Which we will explain to you in more detail in just a little bit. So take note of the branches that you're interested in. Take note of the move-in deadline for that branch. And again, we will go back to this slide in just a few minutes when we get into those details about what it means to take possession of an apartment in order to take advantage of receiving the vaccine. So don't worry if you didn't get all of that information down. Okay, so for now, let's go ahead and get some of those basic questions answered. Some of those commonly asked questions about the vaccine. And to do that, we have two of Bickford's executives who are joining us. First, we have Ann Cheverton. Ann is the Senior Vice President of Resident Services. Hey, Ann, thanks for being with us this morning.
Nice to be here. Thank you.
Great. And then we also have Alan Fairbanks, and Alan is the Executive Vice President of Operations. Alan, thanks for being with us.
Oh, you bet. Absolutely. Thanks for having us. Appreciate the opportunity.
Of course. So I think the very first question we want to get to in terms of these basic questions kind of out of the way is, which vaccine is Bickford administering to their residents, to their Bickford family members, the caregivers and such? And then how many doses does this vaccine require? And I'll turn it over to you guys.
Yeah, thanks for that, Melissa. So initially, we have partnered with Walgreens to conduct clinics in all of our locations. And the initial vaccine is Pfizer. In the majority of our states and locations, that will be the vaccine. There may be, as most of us know, there's some Moderna's been approved, and there's an opportunity that it could be that that gets utilized later on. But what we do know is this: whatever vaccine is utilized, that will be the vaccine that is consistently utilized in that branch and in that clinic. And there will be 2 doses that are administered. They are generally going to be 28 days apart. So what we've been experiencing is when Walgreens has scheduled our initial clinic date, they've also scheduled a second date, in addition a third date, to be able to potentially pick up any individuals that have moved in after that initial clinic has taken place. So the trials have indicated that to be most effective, and we've seen 94% plus effective rates with the vaccine, you must take both vaccines, both doses, not just 1 dose. So it's 2 doses and typically 28 days apart. And the clinics are being conducted by Walgreens, usually Pfizer, could be Moderna, depending on each individual state and that local Walgreens location.
So to follow up with that, Alan, will the folks from Walgreens then come to the community to do that, or will the residents have to go to Walgreens?
No, they'll come to the community. Walgreens will come conduct clinics in our locations. They will come with their own personnel, and certainly Bickford will have personnel to support that as well, from an RN perspective, from a leadership director perspective. So there will be Bickford personnel there as well. So we'll have you covered from Walgreens personnel, and Bickford's personnel. Will be plenty of people there to hold your hand throughout the entire process.
Fantastic. So Ann, this is probably for you. So why would you say, as a health professional, why should seniors get the vaccine now as opposed to waiting until the spring, when I believe is when those who are 75 and older will have access to the vaccine? Why do this right now? And are seniors more at risk if they don't get the vaccine now?
Yeah, I think that's a great point. We know already, the data has shown us that our seniors today are more at risk than the general population, especially those over 75, which is the majority of our residents at Bickford Senior Living. And the death outcomes are very, very high with this particular group. So it is really a life-saving vaccination. It's going to prevent the infection and really prevent those bad outcomes that we see more with residents that have other comorbidities, other diseases that already weaken them coming into an infection. So the risk is much higher by age, by disease type as well. It's very, very important they get the vaccine, so then they're protected.
Mm-hmm. Very good. A lot of people I've heard, just in the general public, they talk about how quickly these vaccines were produced, and there is a little bit of worry around that. They were produced quickly, they were approved quickly. Do we need to worry about that?
That's another concern we've seen really in the internet as well. All of these different questions about, is it safe? These vaccines have been produced very quickly because there was a great collaboration between multiple countries, governments releasing funds, the private sector, pharmaceuticals really jumping in. Some of these vaccines have already been in place with coronavirus. This is a different version of it. So they have these mRNA vaccines already kind of ready to go for regular coronavirus. So just trying to modify them to be ready for this, be mass produced, was done very quickly. No step in the process of the approval of FDA was missed. They go through very stringent guidelines and review. And we know today that at least 3,000 participants have to take the vaccine for it to approve from a phase 3 to a phase 4 clinical trial. We've had over 50,000 people have received the vaccine in that trial setting. And today, we also have seen over 4 million people have been vaccinated as well in our country. So we know that the vaccines are safe. We know the side effects are fairly minimal, and people are doing well with these vaccines.
You mentioned these side effects. Let's talk a little bit about what some of those side effects are.
Most of the side effects are very similar to taking any kind of flu shot that most of our residents take during the flu season. You might get a little bit of soreness at the site where you had the injection. We've done several clinics already, and we're seeing very, very minor pain at the site. But more typically, as your body starts to build up some immunity to the vaccine, you might have that initial reaction of maybe a headache, maybe a slight fever, maybe some body aches. These normally last for no more than a day or so, and you can recover from those very, very quickly. As long as people can take some Tylenol or Advil, or certainly take some fluids, make sure they have plenty of rest. We do know the second dose of the vaccine sometimes has more side effects. And so again, just making sure you're rested, to take fluids, take some Tylenol or Advil if needed. Most of these symptoms should be pretty mild and people can recover and even work with those symptoms.
So another thing that I'm sorry.
One thing I would add, Melissa, to the earlier question that you asked, Anne, in regards to the safety of the vaccine is, I think so many times people look at the speed at which this was done as a negative. One, I look at it as a positive because it's something that can happen quickly to be able to save the number of lives that this vaccine is going to save. And also, there's been so much publicity and so much known of this vaccine and this COVID. Can you imagine the stringency in which all eyes were watching? So my belief is that this is probably as safe and safer than any other vaccine that's ever been produced, because there's more people paying attention to this than anything that's ever been developed ever, in my opinion, just because of the number of individuals that are paying attention to this.
Such a good point.
I just add to that too, because really where the scientific community is looking at this is modernizing how we're managing vaccines today. This is innovative times for us. So this is not something that's done in a hurry. It's something that's really moved us as an industry in managing vaccines very differently than we have in the past. So this is actually innovative times that the pandemic has really pushed us into.
Another thing that has come up, or a question that's come up by folks, is can they get COVID-19 from taking the vaccine, or can they somehow give it to somebody else, give the virus to somebody else if they get the vaccine?
That's another really good question. Typical vaccines that have been produced in the past are often the actual virus itself. It's attenuated, it's not live necessarily, so it's vaccine you can take in smaller doses. This is different. These two particular vaccines that are out are called mRNA vaccines. These are genetic material. And what they do is they take a small amount of protein from the virus itself, and this obviously is injected, it goes into a cell, and that protein itself is what the body reacts to. So actually you're not getting any kind of virus at all, no live virus. You can't replicate virus from this. Also, that means if you don't have the virus, you can't give it to someone either. So it also means that you will not be able to give it to someone else. So people are safe in taking the vaccine, and other people with them are not at risk from getting coronavirus from the vaccine.
So what about a senior that perhaps has had COVID-19 already? Do they still need to get the vaccine?
As this is a new virus, even though coronaviruses have been around for a long time, this is a new version of it. And so I think because we know our seniors are most at risk, the advice from the CDC and from the federal government is for seniors, even if they've had it and or anyone who had it in the past, to certainly have the vaccine. It gives you active immunity, it gives you that protection. We don't know how much protection you get from the actual having the infection itself. So this is an ounce of precaution, but certainly highly recommended that they do take the vaccine, even if they've had coronavirus.
I think so many of us are just, we're all growing weary, and our hope is that we're going to get this vaccine, and then we're going to be able to set the mask aside, and we're not going to have to worry about social distancing. Is that in fact what's going to happen? And if it is, when will that be, or do we know?
Well, I wish I could, answer that question, but the reality is we don't know. I do think this is certainly the step to move in that direction. Our stance will be that we will continue with the protocols that we currently have in place. We will continue to have caregivers in masks. We will continue to screen visitors, because the reality is we're not going to know who has taken the vaccine and who hasn't taken the vaccine from any individuals coming into our branches. So we will continue to follow the same infection control protocols that we had pre-COVID and those more stringent post-COVID protocols we put in place as well. So I do believe, though, that soon we'll be able to move into worlds where our residents will be able to participate in communal dining. They'll be able to dine once again with their friends. You know, they'll be able to have activities within our locations in a group manner, in a group setting. So this will be a way for us to more quickly move into more of a normal world than certainly if we did not have the vaccine. So I do think we'll be able to move into that in a much more quicker fashion than we would if we didn't have the vaccine.
Awesome. We are going to get these dates back up here on the screen in just a moment for folks to know, for those who are considering a move into Bickford at this time, to be able to take advantage of this vaccine. Before we get to that, though, I want to kind of close this section out with you two. Is there anything else that you want to bring out about this vaccine coming into Bickford at this time that I haven't already asked you?
Yeah, for us and for Bickford, I think the thing that I would add is that we are going to continue to really strongly encourage and get as much participation in the vaccine as we possibly can, both from our residents, from our employees, our Bickford family members. I want that for everyone in the community, because I think this is our best chance to be able to move into a world where we can eradicate COVID from our world and from our communities. So we are going to continue to strongly encourage our residents and our BFMs to participate. What's happening is we're scheduling 3 clinics. The great news is if someone should happen to miss the first clinic, they're going to be able to participate in the second clinic and then the subsequent 3rd clinic as well. So our belief and hope is that we're going to get a large participation of residents and employees in our clinics and be able to get into a situation where we have a lot of immunity within our branches. And that's my hope and desire, that we'll see that out in the community at large as well. Exciting news to hear. Anne, any final thoughts from you for this particular part of our Q&A? Yeah.
Yeah, I think that for me, it's about the numbers. We're over 20 million people infected with coronavirus, and we know the number is probably much higher. Testing wasn't in place early in the day. We know right now the pace of coronavirus is about 1.5 million people are getting coronavirus every week. We know our seniors are most vulnerable. And so for me, the game changer, the only thing that's going to affect this is clearly wearing masks and social distancing isn't doing it. Holidays have kept everyone together. So we know the only way for this to be eradicated is to take the vaccine. And so that's our strong stance. We are really strongly recommending people take the vaccine. It's a game changer for this pandemic.
Alan, thank you so much for being with us. Anne, I know you're going to stick around to answer some more questions. In fact, we're going to get to Marie's question here in just a minute. But before we do that, I just want to remind folks how to ask a question. There's that form that's just below the frame that you're looking at right now. Just down there is a form. You submit your question, put in your name, of course, hit submit. Those are coming to us and we will get those answered today for sure. So I want to bring in a couple of other people here. Anne, thanks for sticking around. We also have with us Samantha Goodman, who's the Director of Sales for Bickford. And we also have Shannon Riberty, the Divisional Director of Operations. Hi, how are you all doing today? Doing okay?
Good, thank you.
Sounds good. Good. Let's get to Marie's question. And I think, Anne, this is probably best for you.
Sure.
She's asking, if a reaction should happen to one of the residents, I'm sure she means from the vaccine, what is the plan if that happens?
Great question. Obviously, we had to pre-plan for this, as does Walgreens. And Walgreens, as you probably know, is the pharmacy that's coming to administer the vaccines for us in our national program that we signed up for. And so they have a protocol they follow, as we would follow if someone had a severe allergic reaction. And just to give you a sense of that, there's been about 21 of them in the 13 million doses given already. So far, very low stats on severe anaphylaxis reaction, but they do have EpiPens in place to give, and obviously that would be an emergency call to 911. We'd start any kind of interventions in the branch before EMS would get there. Most of the reactions that we're seeing typically, if they are going to occur like that, would be in that first 15 minutes. That's why we make them wait with us for 15 minutes. Some are reactions that happen a bit later, which are more of that immune response. We have the achiness, so maybe you're feeling like you have a fever and those kinds of things, a headache, versus an allergic reaction, which would be swelling and itching and those kinds of things. So we have interventions in place for that. If someone has any side effects from that afterwards, Pfizer and both Moderna have recommended Tylenol or Advil to help with those symptoms. But the main thing we want is our residents to be well hydrated before they take the shot. They've had a breakfast, they've had a lunch, to make sure they're safe to take that shot, because that tends to take away the issue of headache and those kinds of things.
Oh, very interesting. Okay, that's great. So for the folks in Northern Illinois, I kind of want to shift gears now from that and go back to, if we can show the slide with the move-in deadlines on it. There we go. So February and March are the deadlines for the move-ins to your area for the Bickford communities. And as we take a look at those, I want to ask a few questions around this. So Samantha, is the deadline date the date that a new resident would need to physically be moved in, or is that more like a signed agreement? How does that work?
Right. And so I think that absolutely. The important part there is not that you wouldn't have to necessarily physically be there. It is a signed contract. And so what that is for us is a signed apartment possession, which is that you would own the apartment, but you don't have to have all of your furniture, your house sold, all of those things. It's just a signed apartment possession with us, which is owning the apartment, because that in itself, in that time frame, could be a little bit overwhelming having to do all of that at one time. And we understand that. Mm-hmm.
So what can you help us with some of the steps that people would need to take in order to meet the deadline? Is it literally just, I have to have a signed agreement and that's it? Or are there other things that we need to know about?
Right. Well, and I think Shannon can probably help me with that one. I think that we obviously would want to make sure that you are comfortable with moving into with us and know about our branches and our community. And so with us, signing a contract with us and taking apartment possession is going to be the most important part. And so Shannon can talk to the steps that we would do there, but we would want you to tour and be comfortable, make sure that we are going to be a good fit for you. But signing an apartment possession is a signed contract with us. And so Shannon can talk a little bit more about that.
Okay, thank you, Samantha. So yes, the Bickford family member that you're at your Bickford local community can either do a couple of things to get that apartment possession contract to you. It can either be emailed to you. The community relations director and the RN coordinator would be happy to drop it off to bring it to you, or you can simply bring it to the branch as well. Once that is completed, then we will schedule, dates for that physical move-in date and get all the necessary paperwork for that. But again, as Samantha stated, it is possible to secure that apartment possession by signing the agreement that essentially puts your loved one as an official Bickford, resident. And they would be eligible to come and receive the vaccine, even if their physical move-in date into the branch would occur after the date the vaccination clinic starts.
Very, very helpful. I have a question here from Craig, and he wants to know, will Walgreens issue certification that the resident has received the vaccine?
Oh, that's a good question. Actually, what they do have is a vaccination card. So back in the days, many years ago, when people would have polio vaccines and things, you'd have a little card that would have the date of your first vaccine and then your second vaccine. It's exactly the same. The branch will hold on to those, obviously, for the resident, just so we make sure we have those. We bring those back for our second vaccine clinic. So then that Walgreens representative can see they had their first vaccine. We also track all the vaccines in our own electronic system and all the side effects as well. And we bring that back to that second clinic and the first clinic to make sure that, the Walgreens reps are really clear on the safety of giving the vaccine to our residents and to our BFMs, our staff members as well.
Cool. Meredith has a question here. Meredith's question is, what will be the visitation protocol? And I'm assuming what she's asking is after the vaccine has been administered.
Well, I think probably what I'd love to tell you is you have the vaccine and 5 minutes later you can have that visit. And obviously we know that there's a process in place. So the vaccines, as you heard earlier, and you probably are aware, are in 2 doses. We know that with the first dose, you get partial immunity. There's about a 2-week wait. Then you have on the 3rd week, your second dose, you have about a 2-week window. So we know that the full effect of the vaccine and keeping your loved one safe is 2 weeks after that second vaccine. Also remember that we have to follow very strict state guidelines. And Illinois, as you know, you live in Illinois, or your loved one lives in Illinois, you know that it's been very, very strict. Illinois has been very hardly hit, very metropolitan areas with coronavirus. And so Illinois has a reopening plan. It's different tiers of mitigation based on infection rates, hospitalizations, death rates, and those kinds of things. And so it's we have to follow our state guidelines. We have our own internal guideline that we use for opening up our branches. And I don't anticipate we're going to need to wait to all the way through the second set of dosing and immunity to allow some visitation to occur. But we're very much having to wait until we find out from our state and local bodies. But Shannon, as your kind of boots on the ground there in Illinois, anything else to add to that?
Oh, you're exactly right. In fact, I got some correspondence from the Illinois Department of Public Health just right prior to this call. Many people are aware that your region, the positivity rate in your region may have decreased and met the criteria to go to the lower mitigation level. And what the IDPH organization is stating is that long-term care, which they're considering assisted living to be a part of, will follow 2 weeks behind what the overall general public mitigation levels are. So probably speaking to that same 14-day window that you're referring to, Anne.
Yep, sounds good. Thank you.
Okay. Oh, thank you for that question too. So Cheryl has a question. If your loved one is on a wait list, how does that affect those who want the vaccine?
Right. So I think I can speak to that. The wait list, at this point, you would have to actually be a resident of Bickford to be able to move in and get the vaccine. So being on the wait list gives you a first priority, and it allows you to move in when an apartment is available. It gives you a first priority to an apartment, right? So like if you are in a full branch and an apartment comes available, depending on where you are on that wait list, you can, if you're at the top of that wait list, you can move into the branch when an apartment comes available, when that opportunity is available to you. However, just because you're on the wait list, if there's not availability at that specific branch, you are not entitled to get a vaccine. You would have to physically either be signed with a contract with us with an apartment possession, or be a resident of that branch to be able to get the vaccine. It's for those residents that are living in the branch or have a signed apartment contract with us at this time.
Got it. This question goes back to the question that was asked prior to that one from Susan, and it's about those visitors that will be allowed in after the second dose of the vaccine. So to put it really simply, it sounds like is there a 2-week period, or what is the visitation protocol then going forward?
Yeah, so again, it goes a little bit back to what I said, and unfortunately, because of especially what Shannon just said as well, we're under state guidelines on what we can do from a visitation perspective. So okay. Just to be very clear on that. So we don't have the ability yet to offer a visitation today, but we know this is a moving target, and we know that this may certainly change. We do know at least from today, we've got the kind of 2-week time period before we can follow those state guidelines. And so the branches, though, are your key source of information. So the idea is if you do sign up to become a resident of Bickford, you have that agreement in place. We're going to be able to give you the latest information on that and on the visitation components. Again, the other piece that makes that a bit more complex is if, for example, we had an outbreak that occurred, that would change those dates as well. So it's a very difficult question to give you a specific answer on. I'd love to say tomorrow, I would. Trust me, I would. But we will certainly, as you have specific questions after you move in or during the move-in process, we can probably give you closer to a realistic timeline and date, hopefully based on the status of what's going on in that branch, in that community and in the state itself.
Thanks for elaborating on that, Anne. And Susan, I hope that answered your question. And I hope it answered Dawn's question too, because Dawn's was very similar to that one as well. So now I want to go to Thomas's question. So Thomas's question is, how long does the U.S. Health Department or CDC suggest waiting before you receive the vaccine if you've tested positive to COVID and you already went through the required isolation period as advised? That's the first question from Thomas.
That's another really good question. And there's a lot of misinformation out there. I even see physicians today still making decisions not following CDC guidelines. And just to be very clear, we follow all CDC guidelines and have since really the beginning of the pandemic. So, and we know, as we said earlier, we feel like the fact that we don't know the full immunity you get with getting coronavirus. We're still learning about the immunity you get with vaccines. So there's a clearing period. They want about a 2-week period from the time you've recovered from the coronavirus before you get the vaccine. So a 2-week period is required, and that's directly from the CDC.
Very good information. And then here's the second part to Thomas's question, also a good one. Is there a reasonable time period or a period of time that may imply an individual will not develop severe reactions once the vaccine is provided? So once you get the vaccine, is there a period of time when you're pretty confident you're not going to get any side effect reactions?
Yeah, there's the very clearly immediate reactions, which I talked about a little bit earlier in relation to that anaphylaxis. Very, very rare, small numbers. It'll be in that first 15 minutes. The majority will be in that time. Some may be within half an hour or so, but typically that's the time. Most of the experiences people have, if they have it, and it's again 2 to 3% of the population. We've not seen that as much in the vaccines we've given so far. We know that seniors don't react to vaccines as those that are younger. But those reactions would be within 12 to 24 hours, maybe up to 36 hours, where you get the feeling of maybe headache, kind of that flu-like feeling. And that is all to do with your body's immune response to, it's actually masking a response to that vaccine, which is actually a very good sign and symptom to have that. Again, very, very mild. Tylenol is something that will help with that. Rest, lots of liquids, making sure they're well, they're well fed, and they are to get them through that period, resting and what have you. Other symptoms that could be happening within 10 to 12 hours could be allergy types of things, but they might be very mild. It might be more itchiness, it might be a bit of puffiness, those kinds of things. But we want to make sure if you do have what we consider more of an allergic kind of reaction, that we're talking to the primary care provider to make sure that maybe if we need to delay that second shot or pre-medicate before that second shot, we want to make sure we have all of those plans in place when that second dose is due.
Absolutely. And speaking of the second dose is due, that fits in with the deadlines for a move-in. If someone is interested in doing that, Debbie has reached out with a question and she needs some clarity on what the deadlines for a move-in really mean. So Samantha, if we go back to you, maybe Shannon wants to chime in there to kind of help us really be clear to folks about what that deadline date that they see on the screen there for February and March, what that really means.
Right. So let's say Bickford of Rockford right there is February 3rd. So what that would mean is that you're taking possession of the apartment. So you're signing a contract that's saying that that apartment is yours. So for a lot of you, either for you or your loved one, you may still have a house to sell. You may still have some things. You might not have moved all of your furniture in, things like that, but you are going to be paying the base rate of the apartment. So the apartment is physically yours. And so you've taken possession of the apartment. So it is in all rights and legal possession, it is your apartment. And so you can then schedule your move-in, physical move-in at a later date from that, but the apartment would be yours to get that vaccine. So Shannon, do you want to add anything to that for clarification?
Well, I thing excuse me, I did want to add, I don't know if there are any people on from the Tinley Park location, but we just did receive notice late yesterday, and I apologize, I didn't have it updated for the slide, but they have actually moved up the date of the Tinley Park vaccination clinic. So their first dose is going to be this Wednesday. So that would change the move-in deadline for the Tinley Park location to be March the 2nd versus the 10th.
Okay, that's good.
That is good to know.
And I
That's
think
very good to know.
I just asked Sam one question just to clarify. So these dates, Sam, are these dates of vaccination clinics, or the vaccination clinics are within a day or so of this? Just clarify that, would you?
These are the vaccination clinic dates,
Okay.
and this is the second clinic. So as Shannon said, this is the second, like for Bickford of Tinley Park, March 2nd would be the second clinic. So this is the second one, which means these are for us. We have 3 clinics. So this is the second clinic. So it's the hard clinic date for you to be able to get your 2 vaccinations for us to be able to move in.
Okay.
And so just for further clarity, while this slide is up, Cheryl's question is, can a resident receive the vaccine if they move in after the second dose is given?
And do you want to answer that one?
Yeah, I think it's all to do with the signing of the contract. So I think if the contract's in place and you can't move in yet, absolutely, yes. I mean, I think that you're becoming a resident of Bickford, and we're going to find a way to give you that vaccine before you, if it's before you move in.
The physical move-in. If you sign the contract before that date, the physical move-in, you don't have to physically move in before then.
And we're going to show Samantha's contact information again here if you want to take a look at that. Plus that form that's there on that web page where you're watching this presentation today, that will stay live. So even if you don't have a pen and paper to jot down Samantha's information, you can always submit it through that form, and we will get that to Samantha. So if you should have further questions that may come up. You know, I want to pause here for a moment, you guys, because, you know, there are so many great reasons, in my opinion, since about a year that I've been around you guys at Bickford, to know that there's so many more reasons than getting the vaccine why somebody would want to move a loved one to Bickford, because it is a really cool, special company and communities. All of them are. And I think one way to show that is to show this short video of what has been going on in some of the communities that have already received the vaccine. Take a listen.
You're broken down and tired of living life on the merry-go-round, and you can't find a fighter, but I see it in you, so we gon' walk it out. Move mountains, we gon' walk it out, and move mountains. And I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I do it 1,000 times again. And I'll rise up, I like the waves. I'll rise up, in spite of the ache. I'll rise up, and I do it 1,000
that gets to me every time. What a big, big day for those residents and their family members when they know that they have received this vaccine. So, you know, that I think it just shows the importance, if you will, of making this happen for everyone. And I just want to mention real quickly, I will get to Dawn's question. I will get to your question here in just a minute. But I think it just shows how important all of this is, right? Samantha?
Absolutely. Absolutely. I love, that's one of my favorites, my favorite videos. It was so important. The excitement behind that, you know, the hope and the excitement that everyone has around the vaccine and coming together and just being able to, you know, the family, not only the residents that are our family, but for them to see their own families. Everybody's so excited about this and what the vaccine is going to bring for us, for all of us. And so they're excited. Our residents are excited to be out amongst each other, out hugging each other and loving on each other. And we're just all excited about it. So.
It's so good. Anne or Shannon, you have any thoughts about that, or were you like me and you couldn't talk?
Oh, it's that's the tune, the rise up. I mean, that's what it's all about, right? We're getting out. This is the game changer for getting us out of coronavirus, which is just so important. It's such a devastating time, and you know, we kept our doors open. We've wanted to be able to support people through coronavirus. People don't stop needing to have assisted living or long-term care because we have a pandemic in place. And that's important for us, that to make sure that we manage this well and we manage this right, and start people to be able to connect. It's human to connect and love each other, and that's been taken away from us by this virus. And now this is the game changer, which is just phenomenal.
It really is. And Anne, sorry to stop you there, Shannon, but Anne, I think that we really haven't talked a lot about the statistics across the country, because I know it's changing every single day.
Yeah, and I think this is what I try and educate all of our families and residents and our staff on, because it's so important for them to understand the impact of this pandemic, because it's not going away. It will not go away without a vaccine. So just to kind of throw some numbers at you, just in this past day or so, obviously we have over 23 million, almost 23.5 million people, and we know the numbers actually higher that've had coronavirus. We've had, and the numbers now starting to creep up there, almost at 400,000 people have passed away from coronavirus. And we have about 1.5 million cases rolling every 7 days. So it's not going away yet. That number has been pretty consistent for some time and higher than in the earlier days of coronavirus. So we know this is highly impactful. Again, we know it continues. We've just started vaccinations. We're not seeing any change in the numbers yet. We don't expect to. It's small amounts of people that have been vaccinated. We have to vaccinate those that are most vulnerable, which are our seniors. So the good news is the vaccine is the game changer. Vaccine now is getting out. And this is why we're impressing upon our families and our residents and our staff, our BFMs, Bickford family members, to take the vaccine.
Absolutely. And Shannon, I'm sorry, did you want to say something about that sweet video and I cut you off?
No, I really resonate with that video. I had the absolute privilege to be in one of our Bickford branches last Saturday for their first round of their vaccination clinic. And that was definitely the theme that was felt throughout the residents, the staff members. And it really was that feeling of rising up. We could feel it. And we all left with just such a great sense of hope. And it was a beautiful experience.
Oh, I can only imagine. That sounds amazing. So Dawn, I promised you, here is a question from Dawn. I think it's a really good one. So her question is, so will there be another date for vaccination in a month or so? I mean, so let's say folks can't move their loved one in during this time frame. What happens if they move in after the deadline in terms of getting the vaccine, and maybe before it's offered to those over 65 in the spring?
So there's two elements there. So if they were to move in for clinic number 2 to get their first vaccine, we will have a clinic number 3. So there will be 3 clinics. And the CDC allowed for this. They anticipate that not everyone might get the vaccine in the first clinic. They've allowed for 3 days to have that second and third clinic. As far as if someone moves in on that third clinic date, will they have access to vaccine? The question is, I have to say, is we don't actually know for sure, but I will tell you what I do know is that the vaccine already is starting to move out to the big box retail stores. Health departments will have access to vaccines. So obviously, if we have a resident that only had 1 shot and they need their second shot, at the branch, one thing we do is we help with care coordination of services to physicians and what have you. And we'd work with that health department or find out if it's that local Walgreens. The good news, we have connection with our Walgreens coordinators. We may have an inside opportunity there to work with them as well. So I'm not worried if someone doesn't know, if we don't have another clinic coming physically to the branch. I am very certain we will secure a vaccine for our residents. And as you said, they've moved the dates now to 65 and older. So that vaccine is going to become more available in the early spring.
Great. Gina's question, my loved one is already a resident. When do we get the date she will get her vaccine or get vaccinated? Tinley Park starts as early as tomorrow, so I would like to be made aware ahead of time. Is that, how are you handling that with the current residents in the communities and their family members, the communication there? Shannon?
For that. Yes, the director and the RN coordinator have been in contact with all of the designated power of attorneys for our residents and have secured those signed consent forms already. If for some reason, the person asking the question that hasn't happened for them, I would suggest, reaching out to the branch today to ask for either the director or the RN coordinator. They'll make sure that they get you that that consent form so you can get that signed.
All right. Is there anything else that any of you feel like we need to bring out today for the folks of Northern Illinois before we wrap this up? Okay, then. You guys are good, I guess, with everything. So we're going to get Samantha's information back up here. We're just putting up Samantha's contact information for the simplicity of those of you who are attending. If you have a question really for Shannon or Ann or anybody else at Bickford, Samantha is your person. She will get that question answered and she will take care of that. That we just want to keep simple for you. So today it was terrific. I hope that we helped you have a better understanding of the vaccine. We hope that you were able to visualize what it would be like to make a commitment to move into Bickford and the steps that would take. And certainly we hope that we've been able to help you understand just how critical this vaccine is for not only the seniors in your lives, the residents of the communities, but certainly the majority or most of us here in the country. It's a very, very important move to make for sure. So again, if you have questions, you can fill out the form below or jot down that information. Hopefully you did earlier with Samantha's contact information. So thank you all for joining. Shannon and Ann and Sam, thanks so much, you guys. All great information that you shared today.
Thank you.
Thank you.
Yeah.
Move into Bickford. We want to see you and take care.
Yes, move into Bickford is right. It's an incredible place. Have a great day, everybody.
Bye, everyone. Thank you.
Thank you.